When people think about diabetes, they often imagine the common symptoms like excessive thirst or frequent urination. But what if I told you that women experience a completely different set of warning signs, ones that men rarely, if ever, go through? Some of these symptoms might seem minor at first, but they could be your body's early alarm bells that blood sugar levels are out of control. The scary part. Many women ignore them, assuming they're just hormonal changes or regular health issues, only to later discover that these were actually the first signs of diabetes. In today's video, we're going to break down 4 surprising diabetes symptoms that only women experience, symptoms that are often misdiagnosed, misunderstood, or simply overlooked. Some of these could be happening to you right now without you even realizing they're linked to diabetes. So, make sure to watch till the end because spotting these symptoms early can help you take action before things get serious. But before we dive in, welcome to Health Hub, where we bring you the most science-backed health insights to help you live a healthier, more informed life. If you're new here, hit that subscribe button so you never miss our expert-driven content. Now, let's get started. 10. Recurrent yeast infections. If you've been dealing with yeast infections that just won't go away, your blood sugar levels might be to blame. Many women assume that yeast infections happen because of stress, tight clothing, or even hygiene habits, but one of the biggest underlying causes is diabetes-related high blood sugar. Here's why: yeast thrives on sugar. And when your blood sugar levels are constantly high, it creates the perfect environment for yeast to multiply out of control. The result? Persistent itching, burning, unusual discharge, and discomfort that keeps coming back even after treatment. You might take antifungal medications, only to find the infection returning weeks later. This happens because your immune system is weakened, and excess sugar in your bloodstream is feeding the infection. A study published in the Journal of Women's Health found that women with uncontrolled diabetes are up to 3 times more likely to suffer from chronic yeast infections. And here's the most overlooked part: many women with prediabetes, a condition where blood sugar is high but not high enough to be diagnosed as diabetes, already experience recurrent yeast infections before they even realize something is wrong. So, if this has been happening to you, it's time to look beyond temporary treatments and consider checking your blood sugar levels. 9. Urinary tract infections, UTIs. You probably know how painful and frustrating UTIs can be. The burning sensation, constant urge to pee, and discomfort can make daily life miserable. But did you know that frequent UTIs can be an early warning sign of diabetes? Most women think UTIs happen due to dehydration, holding in urine for too long, or even sexual activity, but high blood sugar plays a major role. When blood sugar levels are too high, the body struggles to fight off infections, including bacteria in the urinary tract. Plus, excess glucose in the urine provides the perfect fuel for bacteria to multiply. This means that even if you're treating your UTIs with antibiotics, the infection keeps coming back because your body's natural defense system is weakened. A major study published in Diabetes Care found that women with diabetes are 2 to 3 times more likely to experience chronic UTIs. And here's something even more concerning: some women with diabetes experience UTIs without the usual pain or burning, meaning the infection goes unnoticed and spreads to the kidneys, leading to serious complications. So, if you've noticed that you're constantly battling UTIs despite drinking enough water and practicing good hygiene, your blood sugar levels might be out of balance. Ignoring this symptom could mean missing a critical early warning sign that diabetes is affecting your immune system. 8. Unusual vaginal odor or dryness. Most women experience changes in vaginal health from time to time, but if you've noticed persistent dryness, discomfort, or an unusual odor that doesn't go away, it could be another hidden symptom of diabetes. High blood sugar doesn't just affect your metabolism, it can also disrupt the natural balance of bacteria and moisture levels in your vaginal area. Normally, the vagina maintains a healthy pH balance with a mix of good bacteria that prevent infections and keep everything functioning properly. But when blood sugar is too high, it throws this balance completely off, leading to dryness, irritation, and even an increased risk of bacterial infections. Some women also report experiencing an odd or stronger vaginal odor, which is often misattributed to diet, hygiene, or hormonal changes. And here's something most women don't realize: high blood sugar can actually reduce natural lubrication, making intimacy uncomfortable, and even painful. This can lead to low confidence, stress, and relationship struggles that many women never connect to their blood sugar levels. A study published in the Journal of Sexual Medicine found that women with type 2 diabetes are significantly more likely to experience vaginal dryness and reduced sexual satisfaction. If you've noticed ongoing dryness, discomfort, or odor that doesn't improve, and there's no obvious cause like menopause or a new product, it's important to consider whether diabetes might be behind these changes. 7. Unexplained weight gain or trouble losing weight. Have you ever felt like no matter how much you diet or exercise, the weight just won't budge? Or maybe you've suddenly started gaining weight without changing your eating habits. If so, you're not alone, and this could be a major clue that your body is struggling with insulin resistance. When your body becomes insulin resistant, it stops processing glucose efficiently. Instead of using it for energy, your body stores it as fat, especially around the belly. This is why many women with prediabetes or diabetes notice stubborn weight gain, particularly in the midsection, even when they're following a healthy lifestyle. And here's something even more concerning: many women don't realize that their hormones are being thrown off balance by insulin resistance. When insulin levels are too high, it can lead to higher levels of testosterone, which further disrupts metabolism, increases hunger cravings, and makes it even harder to lose weight. Research from the American Diabetes Association found that up to 80% of women with type 2 diabetes struggle with obesity, or unexplained weight gain due to insulin resistance. But the real problem? Most women don't recognize this as a diabetes symptom. They try harder, cutting calories, increasing workouts, or following extreme diets, only to see no results because the real issue isn't their willpower, it's their blood sugar balance. If you've been struggling to lose weight despite doing everything right, it's time to look deeper into how your body is processing insulin. 6. Polycystic ovary syndrome, PCOS, and irregular periods. If you've been experiencing irregular, missed, or unpredictable periods, it could be more than just hormonal fluctuations. It might be a sign that diabetes is affecting your reproductive system. Many women who struggle with irregular cycles assume it's due to stress, birth control, or lifestyle changes, but what they don't realize is that insulin resistance plays a major role in disrupting ovulation. One of the biggest red flags. PCOS, or polycystic ovary syndrome, a condition that causes cysts to develop on the ovaries, leading to hormonal imbalances, weight gain, acne, excessive facial hair, and fertility issues. Studies show that more than 50% of women with PCOS also have insulin resistance or prediabetes, meaning their body isn't using insulin properly. This causes blood sugar levels to rise, triggering even more hormonal chaos that throws the menstrual cycle out of balance. And here's something most women don't realize: PCOS and diabetes are deeply connected. Research from the Journal of Clinical Endocrinology and Metabolism found that women with PCOS are up to 4 times more likely to develop type 2 diabetes than women without it. That's because insulin resistance forces the body to produce even more insulin, which worsens PCOS symptoms and increases the risk of diabetes at the same time. So, if you've been struggling with irregular periods, heavy bleeding, skipped cycles, or even difficulty getting pregnant, it might be time to check your blood sugar levels. Many women with undiagnosed diabetes are unknowingly suffering from PCOS-related symptoms, thinking it's just a menstrual issue, when in reality, it's their body's way of warning them that something deeper is going on. 5. Depression and mood swings. Have you ever felt like your mood is all over the place? One minute you're fine, and the next you feel anxious, irritated, or even depressed. You might think it's due to stress or hormonal changes, but what if I told you that high blood sugar levels could be the hidden reason behind your emotional roller coaster? Women with diabetes are at a significantly higher risk of experiencing depression, mood swings, and anxiety, yet this symptom often gets completely overlooked. When blood sugar spikes and crashes, it directly affects brain function and neurotransmitters like serotonin and dopamine, which control happiness, motivation, and emotional stability. A study published in Diabetes Care found that women with diabetes are nearly twice as likely to develop depression compared to those without it. But here's where it gets tricky. Many women with diabetes-related mood swings don't connect the dots because the symptoms can mimic everyday stress or hormonal shifts. You might feel irritable, overwhelmed, or mentally drained without realizing that your fluctuating blood sugar levels are making it worse. Plus, when insulin resistance kicks in, it creates chronic inflammation in the brain, which has been linked to a higher risk of anxiety and depression. And there's another hidden factor: poor sleep. Women with high blood sugar often struggle with insomnia, restless sleep, or waking up exhausted, which only makes mood swings and emotional distress even worse. The problem: many women seek therapy or medication for depression without ever considering that their unbalanced blood sugar might be the root cause. If you've been experiencing unexplained sadness, anxiety, or mood swings, it's time to check your glucose levels, because mental health and diabetes are more connected than most people realize. 4. Skin changes and dark patches. Have you noticed dark, velvety patches of skin forming on your neck, underarms, or even around your groin? Many women assume this is just a skin issue or aging, but in reality, it's one of the most overlooked warning signs of insulin resistance and diabetes. This condition is called acanthosis nigricans, and it happens when high insulin levels trigger skin cells to multiply rapidly, causing these darkened areas to appear. The patches may feel slightly thicker, softer, or even look like dirt that won't wash off, but no matter how much you scrub, the discoloration remains. What most people don't realize is that this isn't a cosmetic issue, it's a serious red flag that your body is struggling to process insulin properly. According to research from the American Academy of Dermatology, women who develop these dark patches are at a significantly higher risk of developing type 2 diabetes within the next 5 years. And it's not just about skin color changes. Some women also experience skin tags, extreme dryness, or even excessive oiliness, which are all subtle signs that blood sugar imbalances are affecting the skin. But here's something most women don't expect: diabetes can also cause hard, thick, waxy skin on the fingers, toes, and hands, making it harder to move joints or grip objects properly. This is a condition called diabetic dermopathy, and it's often mistaken for aging or poor circulation when in reality, it's a warning sign that diabetes is progressing. If you've noticed sudden skin changes, unexplained dark patches, or thickened skin, don't ignore them. Your body is trying to tell you something, and early detection could make all the difference. 3. Slow healing cuts and frequent bruising. Have you ever gotten a small cut, scrape, or bruise that took forever to heal? Maybe you've noticed that a simple scratch turns into a lingering wound, or that bruises appear on your body without you remembering how you got them. This is one of the clearest signs that diabetes is affecting your circulation and immune system, yet many women overlook it. When blood sugar levels are high, they damage blood vessels and slow down the body's natural healing process. This means that even minor injuries take weeks or even months to heal, increasing the risk of infections, scars, and complications. A study published in Diabetes Research and Clinical Practice found that women with diabetes take significantly longer to recover from wounds compared to non-diabetic women, and in severe cases, poor circulation can even lead to nerve damage or ulcers. But it's not just about slow healing. Frequent bruising is another major red flag. When insulin resistance causes poor blood circulation, small blood vessels under the skin become fragile, making it easier for bruises to form. Some women also experience red or purple spots on their legs, arms, or abdomen, which can be a sign of weakened capillaries due to high glucose levels. And here's something even more shocking: if cuts, wounds, or infections aren't healing properly, it could lead to serious complications like bacterial infections, ulcers, or even amputation in extreme cases. That's why it's so important to pay attention to your body's healing process. If you've noticed that small wounds take longer to close, or that you bruise easily, don't brush it off as a minor issue. Your blood sugar levels could be the real culprit. 2. Thinning hair and hair loss. Have you noticed that your hair seems to be getting thinner, weaker, or falling out more than usual? Maybe every time you brush, you see clumps of hair left behind, or perhaps your ponytail feels smaller and less full than it used to. If this sounds familiar, it could be a sign that high blood sugar is disrupting your hair growth cycle, and unfortunately, most people don't realize this until they've already lost a significant amount of hair. Here's how it happens. When blood sugar levels are consistently high, it damages the small blood vessels that supply oxygen and nutrients to the hair follicles. Over time, this weakens the hair's natural growth cycle, leading to excessive shedding, slower regrowth, and overall thinning. A study published in the Journal of Dermatology and Endocrinology found that people with insulin resistance are at a much higher risk of experiencing hair thinning and hair loss due to poor circulation and hormonal imbalances. And it's not just about blood flow. Hormones also play a massive role in hair health. Women with high insulin levels often experience increased levels of androgens, which are male hormones that can trigger hair thinning on the scalp and excess facial hair growth at the same time. This is why many women with diabetes notice a receding hairline, thinning around the crown, or even bald spots, while also developing unwanted hair on the chin, jawline, or upper lip. Plus, there's another hidden connection: stress and poor sleep. When your body is struggling to regulate blood sugar, it increases cortisol levels, the stress hormone that accelerates hair loss and prevents proper regrowth. And if that wasn't enough, diabetes also affects the production of essential proteins like keratin and collagen, which are responsible for keeping your hair strong, thick, and healthy. But here's the good news: if caught early, diabetes-related hair loss can be reversed. Studies show that by stabilizing blood sugar, improving circulation, and balancing hormones, many people can regrow lost hair and restore thickness over time. So if you've been struggling with unexplained hair thinning, excessive shedding, or changes in texture, don't ignore it. Your hair is trying to tell you that something deeper is going on. 1. Extreme fatigue and lack of energy. Have you ever woken up after a full night's sleep and still felt completely drained and exhausted? Or maybe you find yourself struggling to get through the day, constantly needing caffeine or naps just to function. If this sounds like you, your body might be dealing with severe blood sugar fluctuations that are robbing you of your energy, and trust me, this is something you don't want to ignore. The biggest problem: many people assume they're just tired because of a busy lifestyle, stress, or poor sleep habits, when in reality, it could be a major warning sign that their blood sugar is out of control. When blood sugar levels spike, your body burns through energy too quickly, leading to a sudden crash that leaves you feeling completely wiped out. And when this happens over and over again, your body never fully recovers, making you feel sluggish, weak, and mentally foggy all the time. A study published in the Diabetes Care Journal found that people with insulin resistance experience chronic fatigue because their cells can't absorb glucose properly, meaning their body is literally starving for energy, even when there's plenty of sugar in the bloodstream. And here's the scary part: this cycle of exhaustion can continue for years before diabetes is ever diagnosed. But there's more. Dehydration also plays a huge role in extreme fatigue. When blood sugar is high, your kidneys work overtime to flush out the excess glucose, causing frequent urination and dehydration. And when your body is dehydrated, even at a mild level, it leads to brain fog, dizziness, headaches, and muscle weakness, making you feel even more drained and unmotivated. Plus, if diabetes is affecting your sleep, it makes everything worse. High blood sugar levels interfere with melatonin production, making it harder to fall asleep and stay asleep, while low blood sugar during the night can cause night sweats, restlessness, and sudden wake-ups. And when you don't get enough quality sleep, your body struggles to regulate insulin even more, creating a vicious cycle of exhaustion that never seems to end. So if you've been constantly fatigued, feeling sluggish, or struggling with brain fog, don't ignore it. Your body is trying to tell you something is wrong, and catching it early could be the key to getting your energy back and preventing diabetes from progressing further. Conclusion: now that you've seen these 10 early symptoms of diabetes that most women overlook, the real question is, how many of these have you noticed in yourself? If you've been experiencing unexplained changes in your body, mood, skin, or energy levels, it's time to pay attention and take action before it's too late. Diabetes doesn't happen overnight, it develops slowly, often showing small warning signs that most people ignore. But the good news is that early detection can make all the difference. If you catch these symptoms early, you have the chance to reverse insulin resistance, balance your blood sugar, and prevent diabetes from taking control of your life. So, what should you do next? Start by getting your blood sugar checked. If you've noticed multiple symptoms from this list, it's a good idea to talk to your doctor, make lifestyle changes, and start taking control of your health right now. Remember, the sooner you take action, the easier it is to prevent serious complications in the future. And if you found this video helpful, make sure to subscribe to Health Hub, so you never miss out on life-changing information about managing blood sugar, preventing diabetes, and living your healthiest life. Stay informed, stay proactive, and take charge of your health today.